Hi dearies, and welcome to my YouTube channel. Anastasia Obilo here. I'm a registered nurse. I've been a registered nurse going now on 5 years, and I've attended quite a number of job interviews looking for a job in Nigeria. And with my experience with going on job interviews, there are 3 things I would say you should never say in a nursing job interview. And that is what we are going to talk about now. So if you're new here, please give this video a like, subscribe if you haven't at this point, and turn on your bell notification so that you're notified when I'm here again with another interesting video. Let's just get into it. 3 things. So number 1 thing I would say you should never say in a nursing job interview is, I don't know. Make an attempt. Be wrong. What is encephalopathy? I don't know. What would you do when this patient is doing this? I don't know. What would you do when this patient is doing that? I don't know. What would you do in this emergency situation? I don't know. Make an attempt. Let the interviewer know that you know what this entails. It's better to be on the verge of, I have not done this procedure before. I have not carried out this procedure before. I've not been in this situation before. I've not read about this before. But I will do this. I will do that. Then you might be even corrected by the interviewer. The interviewer might even enlighten you on this is what you should do, this is what you will do. But you are not coming off as you don't know what you're doing, because obviously you cannot know everything. But if every question you're being asked, I don't know, I cannot. And in most cases, you even have an idea, but you're scared to get it wrong. Let the person know that you know what you're doing. It's just that this particular area, you have not dealt with it before. That is why you can't exactly give a direct answer. Are we clear? Are we clear? So number 2 on my list is complain about your previous place of work. See, instead of complaining about your previous place of work, focus on talking about your experience. Don't go and start saying, I was always the only one on duty, that's why I had to leave. Instead, talk about how you've handled difficult situations. Focus on that. Talk about how you've handled difficult situations. Talk about how you've handled certain emergency situations. Talk about how you've come through for the hospital. This is even mostly for people who have certain level of experiences. Please do not go there complaining about your MD. Do not go there complaining about the doctors you work with. Do not go there complaining about your professional colleagues. It is not necessary. They are not your target audience for that kind of conversation. They are not your target audience, I promise you. Do not complain. I'm saying this from a place of experience. Like, let me know. Let's not personalize this yet. So, number 3 on my list is you can work under pressure. See, working in a hospital in Nigeria, be sure you understand what that system demands of you before you say, I can work under pressure. Be sure you understand the kind of setting. Is that a primary health care? Is it secondary? Is it tertiary? Before you make that statement of, I can work under pressure, I can handle anything. See, I worked in a place where I was always the only one on shift. There was no gate man. I was closing the gates. I was starting generator for a hospital. And this is a hospital that has close to 15 beds. Be sure you understand what it means to work under pressure. And of course, there are days where there's practically no patients. Like, there's no inpatient, there's no outpatients, especially maybe on night duties. But there were also days where I had 7 patients at once and I was the only one. And mind you, this is my first job. Just be rest assured that whatever you're doing at any point in time, once there is a situation to be managed and a nurse is needed, you're also going to be the nurse to attend to that situation, because you're always going to be alone on shift. Again, be sure you understand what it means. Don't go and look at a private hospital that has 10 beds and then you boldly say, sir, yes, I can work under pressure, I can do anything. And the annoying part about systems like this is that the pay is not even as, the pay is peanuts compared to what you do. Like, it's peanuts. Like, now I told you that I was practically a gate man, a pharmacist. My job scarred me to an extent where I didn't know that there was something called healthcare assistants. Maybe you have an inpatient. Healthcare assistants can be the ones to go get the patient's drugs from the pharmacist. You know, when I would hear, when I had just resumed and I hear people complaining about the job, just we being Nigerians and never being satisfied now. And then they were complaining and I'm like, you guys are balling here. I can have somebody together with me on shift, and I'm not scared that how will I handle this if this certain kind of situation is presented. So be sure you understand what it means when you're saying you can work under pressure. Be sure you understand what that means. Don't go and be writing on your CV, I can work under pressure. There's no situation I cannot handle. I can work 2 shifts in one night. Please be sure you understand what it means when you say you can work under pressure before you write that in your CV, before you are boldly saying that, and before you get that one nursing job. I think this happens especially in Nigeria, even outside the country. Instead of doing all this, instead of saying all this, instead highlight your experiences, talk about your skills. If you're planning on further studies, if you're even on with it, please talk about it. Be sure you're including it, just so that you know whether, the hospital or the healthcare system is open to even sponsoring your education for study leaves. Highlight how you've handled certain situations, especially if you have experience from previous hospitals or if you've worked in certain places. And if you're a new grad nurse, please highlight what you're willing to do. Even talk about what you've done during your clinical experiences. If there's a program that you're going for, or if it's something you're planning to do while you're working, in some cases is actually safe to not mention. Actually, in most cases, they do not want to employ someone who they feel their stay in the hospital is not guaranteed. So use safe words. You can say maybe in future or whatnot. Just study the environment. Be sure that you're watching the interviewer, and just let the interviewer direct his questions based on your responses. Anyways, if you picked something from this video, if you liked this video, please do well to give this video a thumbs up. Subscribe if you haven't, click on that subscribe button just so that you see me on another interesting video. And share this video to someone you know is going for a job interview and should know that there are 3 things you should never say in a nursing job interview. And and a few tips that I've mentioned here that you can probably highlight when you are in a nursing job interview. So if you found this video helpful, do not forget to share this video to your friends, family, whosoever you know that this video will be helpful to. Like this video, subscribe if you haven't, and I don't know if I introduced myself. Anastasia Obilo here. Like I said, I'm a registered nurse. I've been a registered nurse going on 5 years now. And I'll see you all in my next one. Bye. Mwah.